Hello, my name is Hajo van Bijma and I'm the founder of Text to Change. We use the mobile phone, simple mobile phones, a lot of voice systems and text message systems to connect social content to people who want that information. So many people now have a mobile phone in their hand, and we believe that at this phase in 2014, the mobile phone is one of the best way on actually reaching out to people in the field and giving them the information they want in a flexible, real-time and cost-effective way. The use of mobile phones for healthcare purposes in emerging markets, also known as mHealth, started around 2007, 2008. There was a lot of expectations in those years, and everybody who was still being pioneering, they were looking at reinventing the wheel all together next to each other. An estimation by UNICEF in 2009 or 2010 was that in Uganda alone, which is not even that big a country, there were like about 40 similar mHealth pilots next to each other, facing the same problems, working with almost the same technologies, looking at solving the same problems. All those pilots together, we call them pilotitis, a big disease with regards to mobile healthcare. Every newly introduced technology or big intervention such as the mHealth sector space has become, is going to be combined with a lot of expectations, with a top of a hype cycle and then a slope, and then it's becoming mature if it's a new sector. And at this moment in 2014, we're looking at the mHealth space and emerging market as becoming mature. So we're hoping that we won't be running into many similar pilots in the same countries anymore, but looking at problems facing scale. Our first mHealth campaign started in 2008, and now we celebrate our biggest one, and that's a healthcare information system for pregnant women in Tanzania.
The government actually has recognized the benefits of using technology in improving public services.
It's almost as if I have a doctor on my phone, and the doctor is with me every step of the way. As a first-time expecting mother, sometimes you don't know what is happening in your belly.
Wazazi Nipendeni is a multimedia campaign coordinated by the Ministry of Health and Social Welfare, supported by several key partners.
Wazazi Nipendeni ni nzuri sana, imenipa mafunzo mengi.
One of the key components is free SMS messages to pregnant mothers, mothers with newborns, and their partners.
This is how the program works. It's very simple. You send the word mtoto on your phone to 15001, and from there you'll be registered automatically and you start receiving these messages. My husband also gets these messages because they come from the Ministry of Health. He trusts them more than the way he trusts other people.
Messages related to care of the women and care of newborns. Everybody in the community can subscribe.
Mume wangu anajua na amefurahi sana kwa sababu alikopo haelewi nini maana ya kumsindikiza mama kliniki na kwenda kupata ushauri na umuhimu wa kwenda kupima. Sababu ukienda kupima ukimwi wewe na mkeo kwa mara ya kwanza kwenda kliniki ni vizuri zaidi, kusudi unaitambua afya yako na ya mwenza wako. Kwa kutumia hii Wazazi Nipendeni, inanufaisha, inaelimisha na inaongoza jinsi gani ya kumhudumia mwanao na pia kujihudumia mwenyewe wakati mjamzito.
We set up a text messaging system where pregnant women can get information during their pregnancy on their basic mobile phone. So they receive text messages based on their needs, on their age, on their even gender. We also have a lot of men opting into our service. The Tanzanian example, The Wazazi program I just talked about, it reached about 400,000 unique visitors in only 1 year. Is a great example on how to design content in such a way that people who receive the information on their mobile phone actually have the experience that it's content specially made for them. So what have we learned from all the mHealth projects that have taken place so far in emerging markets all around Africa, Asia and some parts of South America? For the bigger part, it's really allocate your resources in the right way. Don't spend it too much on technology. Spend your mHealth budget on content development, on knowing what type of context you're facing in different countries and know your target audience. Do more research before you start than just start implementing. If you want to run mHealth projects on a certain scale, then you will have to make sure that you will work in partnerships. Use a research organization, use an organization that is good at creating the content and knowing the context, and work with good program managers. And use incentives. Not only monetized incentives, such as mobile phone credits you can give to people participating in your programs, but also social incentives. Try to create a feedback loop, where if people participate in your mHealth project, also communicate to them what you did with the results, on how it worked and what the healthcare outcomes were, how it improved the healthcare system or not. So really incentives are not only monetized, but also basically working with social incentives. It's very important. Also, the different communication strategies with regards to mHealth projects are very important. The use of mobile phones is a tool, it's not a solution itself. So you should also involve media such as radio or newspapers or face-to-face interventions to make a right communication strategy for your mHealth project. Don't use mobiles alone. Mobiles are an added value to your communication strategy. The big challenges you will face is working with mobile operators. If you're working with big text messaging campaigns such as what Text to Change does, and what we've been doing in the project described in Tanzania, is working with all mobile operators. And sometimes these mobile operators are treated by NGOs or by big organizations as cash cows, as organizations that will pay for whatever demand we have. But that's not the case. Mobile operators are there for profit, for the fast return, short-term vision. So use them wherever you can, but don't think of the mobile operators as the big organization that is going to fund your project. So those are the key main recommendations based upon all the lessons we learned